We're joined by Dr. Thompson, the moderator of Cutting Edge Topics in OB-GYN. Let's talk about some of the hot topics. What's going on in OB-GYN?
Well, I think there's a lot, and potentially the guest speaker. So I moderate the session, but we have individuals from maternal fetal medicine, GYN oncology, Society of Academic Specialists in General Obstetrics and Gynecology. So we cover the whole breadth of general and subspecialty care in obstetrics and gynecology. And each of the speakers will bring what they think is important for their constituents within their clinical groups. So I don't have a set list, but I could certainly guess at some of the things that might be introduced. For instance, Zika virus has been a popular topic for the last couple of years, and maybe it's a little less new this year, but we certainly have more validated information, evidence-based data to tell us what it is about Zika. Before it was very speculative, so that might be more interesting, more practical, and what lessons we can really learn from that. There may be new therapies, new medical surgical therapies, new technology. Obviously the country is embroiled in administrative change, and the American Health Care Act is coming online, or how do we replace the Affordable Care Act? I'm not sure I have the answers to those questions, but those are the sorts of things that might come up as well. So it could be clinical, it could be administrative. The topics vary depending on what they think might be important.
Why do you personally feel it's important for physicians to attend sessions like this?
Well, again, I think the low-hanging fruit, or I think immediate expectations for a lot of folks who come to this are they're going to go walk away with clinical pearls or new clinical guidelines. There may be new screening paradigms or new testing methodology. There might be new therapeutics. It could be medical, it could be surgical, and so I think that's probably draws at least a lot of the clinicians here. But there's a lot more than that, and as I already mentioned, there is the advocacy. There's legislative changes. Now more important than ever is it's hard to run a business, but these things are important. So having administrative tools, billing and coding obviously is extremely important. There's probably no one in the building who doesn't have some opinion on EMRs, how to optimize your EMR, and all these sorts of things go on at an event like this. So it's really very, very broad.
And finally, why do you feel it's important for physicians to attend ACOG?
Again, for exactly the reasons we just said. It just covers so much ground, and whether it be clinical, administrative, and I notice you say physicians, but I would say it extends beyond that. There are a lot of allied healthcare partners that we have that make our days run, ranging from advanced practice providers to administrators to business partners. Again, going back, it takes a lot to run a business today. So I would include all these people, and I think there's something to be learned for all of us from that.
Great, thank you so much. Appreciate your time.